5 years ago I had my op. As my knees are still 100% and I can go up and down the stairs, and no trouble at all. I had both my knees done at the same time. I can recommend that to anybody. Have it over in fun. And I had 2 pleasant surprises. Number 1, there was no pain at all. No pain. And the second, the biggest surprise was I could walk the next day. Unbelievable. Next month I'll be 91. And now I walk up and down the stairs and I feel years younger thanks to my new knees.
I must say I was a bit nervous, but I found the whole thing, I never took one pain tablet, or I found it wonderful. Once in a while sort of it moans a bit, but then I'm overdoing it. Look, I left the hospital very quickly, but we stayed on. We had booked full in a B&B very close to the clinic. So I said to Dr. Dillon, and I said, look, I'm out of here. I'm not a good patient. I've never really been in a hospital in my life. So, but I said, look, I'm just around the corner, so if anything happens, I miss my running, which I can't do. But for the rest, like my hiking, skiing and everything I can do, and that is because I have this knee, and I'm very grateful for that.
Laas jaar voor die operasie was hy so, ek kon hom so omvat, hy was so dun geweest. Daar was geen hamstring, niks nie. Dit was net so 'n stuk vel, want ek trap net met een been. Kon nie trappe klim nie, trappe af, trappe op, skuins afgaan. En dit in die nek ook begin pyn, so half soos nagpyn. Ek het lank uitgestel. Ek het van 78 af, toe ek op universiteit was, het ek my mediale ligamente almal afgeskeer, al my kraakbeen. Daai jare het nog jou kraakbeen uitgehaal. In my agterkop was ek bang vir die ouens wil jou nie te jong doen nie. En toe ek 'n pel gehad het, sê vir my, wat stap jy so bang? Sê ek, maar ook nie, sê maar hy sin nie laat doen op 48. Hy is toe so in sy 50s. En hy sê, en hy gaan op sy hurke af en so aan. Hy sê hy moes dit hankel laat doen. Hankel. Hy het ook in die nag wakker geraak van kniepyn. Hulle noem dit nagpyn. Ek gaan byvoorbeeld, ek doen nou quads wat ek nooit kon gedoen het nie. Nooit. Die fysioterapeut het agterna belang gesukkel om my been reguit te kry. Inteendeel, hy's nou reguiter as hierdie ene, want hierdie ene het 'n cyst hier agter. Wat 'n dokter nou reg gesien het, daar sit 'n cyst. Maar die herstel, ek het maar net gehou weer wat hy vir my gesê het, maar die opbou was baie goed. Ek het dink van week 6 of week 8 seker, het ek toe hy het gesê sodra my been kan begin omgaan, reg rondom kan omgaan, dan kan ek maar op 'n spinningfiets sit. Ek moet sê daai eerste die derde dag. Want ons was 4 ons wat daar gelê. 3 was deur 'n ander dokter gedoen en ek self by Dr. Dillon. En hulle het ook gesê maar ek was voor hulle gedoen. Hulle het ook gesê die derde dag was vir hulle die eerste. Daarna was dit alright geweest. Niks pyn nie, niks. Ek sal seker later hierdie knie moet ook laat doen. Alhoewel hy nog op die oomblik is hy redelik alright. So nee, dit is ongelooflik. En soos ek sê, dokter het goeie werk met my pa gedoen. En my pa was in die 80's, hy stap, hy sê hy het nie wel al nie. My pa is nou 92. Nee, wat my pelle sê ook, hulle nog iets aan my gery wat ek so sterk is. So dit is net ongelooflik.
My recovery period was very quick. After 2 weeks, I was walking without crutches after having both knees replaced and driving. And I can kneel down if I kneel on a cushion. Dr. Dillon said you don't have to be in pain, so if I had any discomfort, then I would have painkillers. And when I got home, I took them when I had pain, and I didn't take them just all the time, only when I had pain. I found the hospital to be amazing. The staff were very kind and caring, and it's beautifully situated, and the wards were very, very comfortable.
I happened to be down in South Africa, so that's when I went to the Mediclinic, and I was told to go and see you, and I did that, and we've never looked back. The knees have been wonderful. I'm able to play bowls again. I'm able to climb mountains. I was out yesterday climbing in the Matopas, which is big granite copies outside Bulawayo, where I live, and it's been absolutely fine.
Well, for what it actually did in my life, it was, I think, one of the best experiences ever. And then they took me to my ward, and as soon as I got to my ward, the nurse came and she said, "Come, let's go for a walk." 3 months after my second knee, my son bought me a ticket to go to Paris. So I was looking forward to it. You know, the Eiffel Tower, everyone talks about it. I never thought in my life I'll see it. And something inside me just said, hey, you've got new knees now. It's a new life. This is what Dr. Dillon said is going to happen to you. Now, you're not trusting what he said and the feelings that you had in hospital after you did the operations. Do it. Just do it. And I said, okay, we're going to shift from this row to the row where the stairs is. And I climbed almost 500 stairs. And I climbed back down as well. Walked around there for 2-3 hours, checking everything out. Walked down each and every step myself. And at the bottom, the only thing that I could say is, I did it.
From a surgeon to patient perspective, he was absolutely fantastic. I couldn't have asked for better pre-operative explanation. He went through everything in detail and really made one feel as comfortable as you could. But the main reason for going to Ed was that he was so well recommended by Professor Walters, as well as a very good friend of mine who's also recently retired orthopedic surgeon in Cape Town. Post-op was much easier than I thought. I had much less pain than I thought I would have. And to be truthful, the only pain I had was when I was doing the physiotherapy torture. Within 24 hours, you're walking with the aid of crutches in the ward, and you're going up and down stairs 48 to 72 hours later. And I was careful because mine was a bit more major than the normal knee replacement. I didn't take full weight bearing until 7 weeks after the operation. But it's been absolutely life-changing. I mean, I used to get home from work, I was in such pain, I was going to lie on the couch, watch TV, have meals brought to me, and have a glass of wine in the evening, and that was me. I couldn't walk 10 meters on the beach without being in severe pain with the knee. And now it's pain-free. There's a dull ache, which he warned me about, in the long bone, but I take no painkillers, I take no anti-inflammatory medicine at all, and life has just changed very, very much. Overall, it was a fantastic experience.
Van die oomblik wat ek by Dr. Dillon ingestap het ek veilig gevoel. Ek het regtig baie veilig gevoel. En sy hele benadering is nugter, dis objektief, dis vakkundig. Ek is professioneel en dit was baie belangrik. Dit is nie dat ek sit van dit sal reg wees of so nie. Ek het my voorberei op alles wat kan gebeur. Vrae gevra, my antwoorde gekry.
From pain to no pain at all. I went to a surgeon and was told that it's not my knee, that it was my back. I was referred to a back man. He told me it wasn't my back, it was my knee. I gave up and I waited for about 4, 5, 6, 7 years, I'm not too sure. And then I couldn't anymore with the pain and I went to Dr. Dillon, and the end result was that he did a knee replacement for me and I've never looked back. My recovery time was quick. 2 months, 2.5, 3 months, if I can remember correctly.
Yeah.
I did work hard at it. I did my physio, I did my exercises, and I'll never look back.
And he showed me what the new prosthesis was like, and the fact that you don't have a full anesthetic, and that clinched it for me. And I went in, and it was the most fantastic transition that I've ever had. I had absolutely no pain. I was walking back up in the mountains 5 weeks after the operation,
And Dr. Dillon was the last I consulted, and I had a very good impression about him. And we went ahead to do the operation. I was actually looking forward because hiking was something I liked very much, and I couldn't do anymore properly. But being a German, I would say I took a little bit more time before I went into the mountains again. So I had a hip replacement, that's how we started. He did a fantastic job because my right leg was shorter than the left one. He lengthened it to the same length. And half a year later, we did a knee operation on top of it, and it worked out perfectly. It's to be recommended. If you whatever you hear about the big hospitals, you know, the problems they have, and also usually people tell you the negative side of an operation, you know, infections. Nothing happened. The stuff was very good, and as Dr. Dillon once mentioned, even the doctors are looking that the hospital is up to shape. You know? That is very good information.
I found it so too.
Yeah.
Staff excellent. The nursing staff were great. The anaesthetist was really helpful during the operation. Just generally, it just got 5 stars all the way through for me.
No, I was recommended to see Dr. Dillon at the medical clinic in Stellenbosch, and an appointment with him, and he was very accommodating and explained the whole thing. He actually went down on his advances to show how the knee will be afterwards and what you won't be able to do. And I appreciated that he told everything it was about. And he showed me the article, or whatever you call the link he was going to put in. So I knew what he was doing. And I appreciate the fact that when I recovered there was no pain. After the operation I could start walking and the pain was gone. I forgot to say, I had so much pain in walking that, but I haven't got any pain now, so it is recommended.
Ik heb baie goed ondervind. Ek het geen pyn gehad nie. En na ek uit die hospitaal uitgekom het, het Dr. Dillon vir my pynpille voorgeskryf wat ek glad nie gebruik het nie. Die eerste 2 weke het ek gewone oefeninge gedoen. En na die tweede week het ek begin op 'n oefenfiets. En na die 4de week het ek begin met my eie fiets, met my padfiets. En na die operasie was dit soos 'n nuwe lewe vir my. Ek het reeds sedert Maart maand al 8000 kilometers met my padfiets gedoen. Ek is gery, wat natuurlik nou maar 'n kortetjie was, maar ek reis normaalweg 1000 kilometers per maand.